Okay, so thank you so much, everyone, for joining us this evening. Today's event is being presented by the Saskatchewan Physiotherapy Association in partnership with the Assembly of First Nations and Continuing Education and Rehabilitation Science. Today, Jenny Gardipy will be presenting on the topic of Assembly of First Nations Advocacy, Allied Health Services. Before we begin today's presentation, I would like to begin by acknowledging that our campuses and sites are on treaty territories and the homeland of the Métis. We respect Indigenous people, have rich cultural and traditional practices that have been known to improve health outcomes. As I present from Saskatoon, I acknowledge I am on Treaty 6 territory, which encompasses the lands of the Cree, the Dakota, Nakota, Saulteaux, and homeland of Métis Nation ancestors of this place, and reaffirm our relationship with one another. I post a picture of my children here, reflecting on my gratitude that I have been born and raised in the prairies and I get to experience it anew through the eyes of my children and appreciate the gifts and opportunities of this land. I was born in Treaty 2 territory, and I am grateful to be able to live, play, and raise my children on Treaty 6 territory. All attendees are invited to reflect on the territories you are calling in from as we commit ourselves to gaining knowledge, forging a new culturally safe relationship, and contributing to reconciliation. For the duration of today's presentation, attendees are automatically muted. Hello, although Jenny did just tell me she wants today to be collaborative. If you have a question during today's presentation, please do not hesitate to raise your virtual hand. So in the bottom, there is a react section where you can raise your hand, or if you rather, you can put your question into the Q&A box, which is along the bottom as well. And I will monitor those questions and help bring them to Jenny's attention. There will additionally be a Q&A period after the presentation, so you're also welcome to engage and save your questions for the end as well. So I highlighted this. Our Q&A is at the bottom of your screen. You can use it to submit a question. You also have the option of having it be an anonymous question as well, and we will bring it forward, or at any time, don't hesitate to pop up your virtual hand and I will unmute you to allow you to ask a question verbally. Sometimes tech issues occur. So even though Zoom asks you to let it use your computer's audio before joining a meeting, at times one misses it. So that could be the reason why others are unable to hear you. To fix it, click on the Join Audio button in the left-hand corner. If you're experiencing network issues, this can also affect your audio. To help troubleshoot these issues, we encourage you to sign out of Zoom and rejoin via the same link, and be sure to join via computer audio. You can also chat with me, your SIRS host, Kendra, in the chat function if you have any other questions. So at this point, I am going to hand the mic over to Adrienne Van Gool to open our evening and to introduce Jenny.
Thank you. And before I introduce Jenny Gardipy, I would like to first thank all of those who are part of the planning and volunteered their time to make this webinar possible. Events like these require a lot of work behind the scenes and are filled with intention. And we thank all of you for the work you've done and for all those in attendance this evening. And most of all, a huge thank you to Jenny for giving her time to share her knowledge and expertise with us. For those that are unfamiliar with such protocol, I would like to let the listeners know that we provided Jenny with an offering and gift in thanks and gratitude for her sharing here today. It is my honor to now introduce Jenny Gardipy. And when I think of Jenny, the first word that comes to mind is matriarch. To me, and I'm sure so many that know her, Jenny truly embodies what it means to be a matriarch through the way she lives her life and in the work she tirelessly does for the Indigenous community locally and across Turtle Island. Jenny Gardipy, a member of the Beardies and Okamasis Cree Nation in Treaty 6 territory, is a mother of 6 and a Kukum, grandmother in Cree, of 5. Jenny received a bachelor's and master's degree in Indigenous Studies in 2007 and 2009, respectively, and Public Health in 2011 consecutively. Subsequently, Jenny worked in community and health related roles within local and national health organizations, such as a director of health for her community and director of business operations for the First Nation and Inuit Health Branch, Saskatchewan region. In 2019, Jenny began her PhD degree at the University of Saskatchewan with a focus on Indigenous peoples with physical disabilities. In 2022, Jenny brought her Indigenous health expertise to the Assembly of First Nations as a senior policy analyst with the NIHB. Jenny's dedication to Indigenous health advocacy is deeply rooted in her personal experiences, observing challenges faced by her mother, who is visually impaired, and her late father, a survivor of the Indian residential school system. Her unwavering belief in the inherent capabilities and wisdom of Indigenous communities drives her passion to attain significant Indigenous health outcomes. Thank you for being here, Jenny. And with that, I'll hand the mic over to you.
Oh, thank you so much for that introduction, Adrienne. That means a lot. Yeah, my name is Jenny Gardipy. I'm from Beardies and Okamasas Cree Nations, as Adrienne noted. I currently live in Saskatoon. I am a mother of 6 and a grandmother of 5 now. We just had a new baby 2 months ago, so he's our little boss of the house. So yes, I'll be talking to you today about my work as a policy analyst, senior policy analyst at the Assembly of First Nations. I started there 2 years ago, and it's been quite the learning journey, and it's also very rewarding because I get to work for First Nations people on a national scale, and I really do appreciate that kind of work, and I do value the role that I'm in, the advocacy and working with and for First Nations people. Thank you to Kendra and Adrienne for inviting me to share this information to a very important group association. I really believe that we need to have this, to collaborate with these different associations, because together we can make sure that we're all on the same page and we're sending the same messages to the powers that be. So I will just begin on the second page. Yeah. So I'll be discussing who the Assembly of First Nations is. Everybody calls it AFN, and what we do for First Nations people. I'll discuss what the health sector, AFN health sector is currently, and it currently consists of anti-Indigenous racism, public health promotion, long-term care, mental health and addictions, and NIHB. I'll talk about a little about the NIHB program and their role. I will talk about AFN advocacy, health advocacy. I'll talk about the Chiefs Committee on Health. I will talk about the AFN resolutions. Excuse me, I just had some bubbly. We'll talk about the NIHB Joint Review Steering Committee, the NIHB navigators, the pre-budget submissions on NIHB, NIHB National Evaluation 2023-24. I will talk about a little bit about the AFN partnerships and moving forward NIHB advocacy and partnerships roadmap. So the AFN is a national advocacy organization representing First Nations all across Turtle Island, which includes more than 900,000 people living in more than 634 First Nations cities, towns across the country. First Nations leaders, or like people like to call them, chiefs or council from coast to coast, provide the mandate for our work through resolutions passed at all First Nations chiefs and assembly that are held twice a year in July and December. In addition, motions passed by the executive committee provide direction in the absence of resolutions reaching the table. The AFN is led by the executive committee, made up of the national chief and 12 regional chiefs who pass motions and make decisions for the AFN. The advisory members on the executive committee include elders, women and youth, and Two-Spirit LGBTQ plus councils. AFN as an advocacy body, facilitates meetings to introduce processes, gather input, issues, serves First Nations on key subject matters with reviews, studies, responses, research, or actions, advances aspirations for First Nations, seeks, utilizes, and distributes resources for the greater benefit of all First Nations. The AFN is comprised, the AFN is comprised of the rights and justice, environment and lands, economy and infrastructure, and community services such as Jordan's Principle and health and well-being. Slide 4. Yeah. So the AFN health sector is mandated to protect, maintain, promote, and support and advocate for First Nations inherent treaty and international legal rights towards ensuring the holistic health and the well-being of First Nations. The central goal of AFN Health Team is First Nations control of the development and delivery of all health services and programs. First Nations knowledge and perspectives must be considered and integrated into health and well-being practices. That's one of one of the things that is always stressed to us when we meet with our community partners, that everything must have a First Nations lens on it. So that's one thing we advocate for, is to make sure that they have a First Nations lens. First Nations have a long-standing history of managing and understanding their own health. AFN ensures the continuation of these practices and approaches within health, and ensures equal participation and collaboration with the government on all health and well-being issues. From a business and reconciliation perspective, the Truth and Reconciliation Commission calls to action, and articles within the United Nations Declaration for Indigenous Peoples Act call to commit to meaningful consultation, building respectful relationships, obtaining the free, prior, and informed consent of First Nations before proceeding with any economic development projects. The NIHB program, slide 5. I'll just talk briefly about this one. Indigenous Services Canada, everybody calls it ISC. NIHB program provides eligible First Nations with coverage for a range of health benefits, such as prescription and over-the-counter medications, dental and orthodontic services, eye exams and corrective eyewear, medical supplies and equipment, mental health and counseling, transportation to access health and services not available locally. As of March 31st, 2023, there are 936,006 First Nations and Inuit clients eligible to receive benefits under the program. However, not everybody has equitable access to this program. We've been hearing from different regions. The NIHB program was designed to play a crucial role in ensuring equitable healthcare for First Nations people and to bridge the gap between healthcare needs of First Nations people and the services covered by provincial and territorial plans. By providing this health coverage, NIHB is also designed to help improve outcomes and quality of life for First Nations individuals and communities, which was to contribute to reducing health disparities and promote greater health equity within First Nations populations. However, we all know this is not the case because there's a glaring healthcare gap between Indigenous people and the rest of Canada. Slide 6. So AFN health sector, that NIHB advocacy, so my role, continues to push for transformative change through sustainable, adequate funding, capacity building, and improved relationships to support First Nations-led healthcare services and programs. Underpinning this approach is the recognition of inherent First Nations and treaty rights to health, AFN resolutions passed by First Nations in Assembly mandate the health sector to do the work. The Chiefs Committee on Health, the First Nations Health Technicians Network, the Truth and Reconciliation Commission Calls to Action, and the United Nations Declaration on the Rights of Indigenous People all provide further guidance to the AFN health sector related to this critical work. First Nations Health and wellness continue to be compromised by deficits across the social determinants of health, evident in poverty, overcrowded housing, and a piecemeal approach to health services and programming. In national and regional dialogues, First Nations have articulated that true health and wellness are strength-based, rooted in culture, guided foundations to move towards resilience and growth. The AFN uses a variety of methods to advocate for First Nations. The AFN health sector and IHB use the following methods to promote health and well-being, and that's the Chiefs Committee on Health, AFN resolutions, NIHB Joint Review Steering Committee, NIHB Navigators, pre-budget submissions, NIHB National Evaluation, and partnerships. And I'll explain each one in the following slides. Slide 7. Any questions so far? Okay, just don't be scared to raise your hand or anything. I don't mind answering questions, and I just want to treat this like an open dialogue. So AFN resolutions, the main advocacy method we use is the AFN resolutions. So twice a year, the First Nations chiefs and their proxies meet at a First Nations Chiefs and Assembly to give policy direction or mandate for the AFN to act on an issue by adopting a resolution. If the resolution didn't make the Chiefs table, the AFN executive has the authority to pass or defer resolutions. For example, a recent resolution passed by the AFN Executive Committee is the NIHB coverage for naturopathic medicine. I'll talk about this a little bit further. Policy initiatives originate from strong First Nations leadership and advocacy. Current challenges faced by First Nations communities in accessing health services in Canada range from socioeconomic advantages, but limited access to quality healthcare. The Western healthcare system often does not consider First Nation values or traditional knowledge of health. Therefore, the Western healthcare system creates a culturally unsafe space for First Nations patients. The resolution for naturopathic medicine directs the AFN to advocate for the Government of Canada to amend the NIHB program to include coverage for services provided by naturopathic doctors, ensuring that First Nations who choose these services have equitable access to comprehensive health care, consistent with the principles of UN Declaration. It also directs the AFN to collaborate with First Nations and their organizations to promote holistic health and wellness while asserting the right for First Nations to choose their form of healthcare and advance the integration of naturopathic medicine into existing healthcare systems and services. They also direct the AFN to engage in dialogue with relevant government authorities, health providers, and Indigenous organizations to advocate for the inclusion of naturopathic services within publicly funded healthcare systems, accessible healthcare options for First Nations.
Jenny, we have our first question.
Oh yeah, for sure.
It's me. You might be getting to this or like later in your presentation, but
yeah,
I'm curious in terms of the resolutions that are made and the way that AFN advocates for those changes in policy as it relates to physio coverage. So I know mental health, like counselors, they're not part of the public system and they can direct bill to NIHB. And I'm wondering if there's ever been a discussion for something like that with physiotherapy, because, you know, as you mentioned in previous slides, there's a discrepancy in the access to services through the public system. And that's right now where, NHB pays and covers is only physio if it's part of the public system. Has there been a discussion about a resolution for something like this?
Yeah, that's one of the things we talked about last year and the year before, was allied health services and how important they are to First Nations health, to anybody's health actually. Back in the early 90s and what's it, late 80s to late 90s, they did have coverage for allied health services. NIHB did provide coverage to under the NIHB program. And back in the late 90s, they removed allied health services because they didn't find any evidence that allied health services was beneficial to health. At that time, in the the late 90s and early 2000s, opioid use began to skyrocket. So for me, there's like such a clear connection as to why there's there's opioid misuse, is because, the physicians, health doctors, anybody else, health technicians didn't have any other recourse but to prescribe medication, opioid medication, because they didn't want their clients suffering, right? So the only thing they had access to was opioid medication. So that's one thing we're bringing out in a report, is we're discussing that, there's that clear linkages and how that's going to impact this resolution that we have. I'm hoping so, because that's there's such a clear connection there. I also met with the naturopathic, I forget her name. She's the Canadian Naturopathic Association. She's one of the directors there. She's also excited about this resolution and how we're going to move forward together. And so I'm just kind of hoping, if this resolution, resolution 02224, I'm hoping that gets put to the floor in December. If not, then I'm hoping in January the executive committee will pass it, just like they did with naturopathic medicine. Did I answer your question, Adrienne?
Yes, thank you. And it's just
Okay.
good to know the pathways of how to direct our advocacy in support of what you all are already doing. So thank you.
Yeah, for sure. Yeah, so like I said, like the Allied Health Services resolution did make the floor at the last assembly and was considered a late resolution. So we have to wait until December 2024 gets to the table. The resolution for Allied Health Services proposes that the AFN advocate to the Government of Canada for the expansion of the NHB program to cover allied health services, ensuring equitable access, holistic health promotion, respect to First Nations health choices, and integrate allied health services into existing healthcare systems. It also asks AFN to engage in dialogue with relevant government authorities, healthcare providers, and First Nations organizations to advocate for the inclusion of allied health services within the NHB program, to confirm culturally appropriate, trauma-informed, and accessible healthcare options for First Nations, and NHB program to conduct a thorough review of the existing NHB program, specifically evaluating the inclusion of allied health services, to collaborate with healthcare professionals, relevant associations, and experts to conduct a comprehensive research on the scope and impact of the NHB coverage for allied health services, considering the diverse healthcare and cultural needs within various regions. And finally, to advocate for adequate resources and funding to support the research and development initiatives aimed at expanding the NHB coverage to include allied health services. Slide 8. Oh, was that? Yeah, slide. Okay. The Chiefs Committee on Health is comprised of First Nations chiefs and First Nations, the National First Nations Health Technicians Network. And they've been in existence since the mid-90s, the Chiefs Committee on Health. They're a designated core committee, which consists of one chief representative from each of the 12 AFN regions selected by their regions. AFN regions will also appoint alternate and political representatives to the committee. The committee meetings will be open to all interested First Nations chiefs and our appointed political representatives. The committee will be chaired by the AFN executive member within the portfolio of health. The committee will be co-chaired by a committee member. The national chief will be an ex-officio member of the Chiefs Committee on Health. An elder from the advisory committee will be appointed, and they're accountable to the AFN Chiefs in Assembly and to the AFN executive. The Chiefs Committee on Health reports on the mandates and progress at General Assemblies regarding all the work that we do at the health sector. The AFN Health Director and staff of the AFN are accountable to the Chiefs Committee of Health and the AFN executive member health portfolio. The mandate of the Chiefs Committee on Health is to protect and maintain our treaty and Aboriginal or Indigenous rights to health and provide advice, guidance, and recommendations to the National Chief, AFN Executive, and Chiefs in Assembly, First Nations Chiefs in Assembly on matters pertaining to First Nations health. Subcommittees may be established as deemed necessary. The objectives of the Chiefs Committee on Health is to promote social progress and improve quality of life and health for First Nations in Canada by advocating for the promotion, recognition, and implementation of First Nations, Indigenous, and treaty right to health, analyzing policies, legislation, programs, and research, ensuring these are implemented based on best interests of First Nations, establishing and carrying out effective communication and liaison strategies with First Nations and other networks. These objectives will be carried out within the mandated Charter and Declaration of First Nations and Assembly of First Nations. Slide 9. So we have a NHB Joint Review Steering Committee. We all know that NHB continues to be a challenge for First Nations because of the NHB program policies and processes that often don't align with First Nations priorities and health needs. So the joint review is an opportunity to work with Indigenous Services Canada, or ISC, First Nations and Inuit Health Branch, FNIB, and NHB to influence what policies should look like. In the fall of 2014, FNIB and AFN began the joint review process in an inaugural meeting to examine coverage and services provided under the NHB program's mandate. The First Nations Chief in Assembly mandated AFN in resolution number 74, 2018, to continue the ongoing review and commitment to the joint review process. And just recently in 2022, Resolution 61, 2022, the Chiefs in Assembly directed AFN to reform the NHB travel policies to ensure northern, remote, and isolated regions are represented. And the NHB Joint Review Steering Committee is currently comprised of 10 First Nations caucus members and 10 Indigenous Service Canada members. I say currently because there will be a review of how the joint review will look within the next year. Currently, the joint review completed the following reviews. In 2016, they did the mental health counseling review. In 2018, they did the dental and vision. 2019, they did pharmacy. 2020, they did medical supplies and equipment, and then COVID happened. And then 2023 to present, we are doing the medical transportation. Because that policy, medical transportation is so So much policy actions in there. It's taken us that long to review it. It's just there's so much detail and wording, so we have to go through line by line at each joint review, and it's only 2 meetings per year. So we started in 2023, and we're hopefully going to finish at the end of November is our next meeting. The Joint Review Steering Committee objectives are to review each benefit to enhance client access, identify and address any gaps, streamline service delivery to be more responsive, and increase program efficiencies. The key considerations for the joint reviews are to identify recommendations and improvements for the NHB program. Main areas such as coverage, communication, access, and administration are what we continue to use as criteria or main ideas for the review. Next page. So we also have the NHB navigators. They're within each region. There's just let's see how many are there. There's 2 in Saskatchewan. Sorry, there's 2 in Saskatchewan, and there's 3 in Alberta. There's 4 in Manitoba. There's 1 in Yukon. There's 1 in Northwest Territories. And Atlantic have 4 or 5, and then Quebec has 1, and Ontario has, how many do they have? They have 3 or 4. So we have part of my job is to host these navigator meetings all across Canada. We try and make sure that we reach each region so that everybody has a chance to host the meeting. We just got back from Whitehorse, and we got to meet the Whitehorse navigator in her homeland. So it was really a good experience for us, and it really was eye-opening too, because all the challenges they have regarding access to healthcare, and then if there's no if there's no dentist or anything in the area, then they have to, fly out to Edmonton. So that's where medical transportation costs just get skyrocketed, because a lot of access issues is because service providers have a challenge trying to go up to the northern communities. So the AFN maintains the NHB Navigator table. Their health technicians that plan and advocate for First Nations NHB national priorities. We meet twice a year throughout this side of the medicine line, aka Canada. NHB Navigators table consists of assigned regional NHB health technicians or navigators to guide and promote First Nations NHB health needs and priorities, as well as challenges. AFN recognizes it's challenging for our people to navigate complex healthcare systems. So the importance of the navigator's role to bridge the healthcare gap and advocate for clients who have limited access to healthcare services and transportation has never been more significant. And one of the things we keep hearing is they've never heard of a healthcare system that needed a navigator as much as the NHB program. So that just says a lot, that it's not as easy as people think it is, the access. The NHB navigators are the eyes and ears on the ground, and we value them. We value their voices. So AFN, along with other First Nations chiefs in assembly, will continue to advocate for the healthcare issues and challenges that the navigators face and the First Nations clients. We have representatives from the 12 regions. British Columbia has the First Nations Health Authority, so they have control of their NHB program. One of the main concerns from the NHB navigators is the lack of movement and improvement to Indigenous Services Canada NHB program and policies. Our current work includes in October last year, we had the NIHB National Dialogue session, and there was a summary report. If you'd like a copy of the report, I could send it to Adrian or Kendra, just let them know. And we also move First Nations health priorities, such as allied health services, and that's one of the advocacy roles that was asked of us to have naturopathic medicine as well as allied health services be covered under NHB. So that's one of our goals, is to continue that. We also, we're at the National Dialogue session. We had clients, navigators, NHB navigators, and service providers attend. And we all kind of just had a discussion on what's working, what's not working, what are the challenges, what can we do together, how can we, improve the services. We had the Indigenous Pharmacy Professionals of Canada speak at the presentation, at the dialogue session, and they had talked about the sole prescriber restrictions under the client safety program and how it really limits the First Nations clients, and it really contributes to the lack of access and discrimination on them. So after that dialogue session, probably about 2 or 3 months later, NIHB discontinued sole prescriber restrictions under the client safety program. So we like to say that it was kind of started with the National Dialogue session. So that's one thing I'd like to say, like, we have a lot of momentum, and it's just keeping the foot on the pedal and making sure that we continue, reiterating the same thing and letting them know that this is not going away. We need to continue listening to what the people are saying. Next slide. We also do pre-budget submissions like a lot of other people. Sorry, I'm not going to drink bubbly before I have a presentation. The AFN proposed a $52 million investment over 5 years to research expanding NHB coverage to include naturopathic medicine and allied health services in Canada, aiming to identify gaps in health services and assess the impact on improving access to quality healthcare. First Nations partners and AFN leaders emphasize the importance of holistic healing methods, need for First Nations to access equitable and holistic healing methods, cost effectiveness of preventative and evidence-based health services, and to adhere to the principles of the truth and reconciliation as pertinent arguments to expand the NHB program to include naturopathic healing and allied health services. So we'll find out hopefully in October if this submission was listened to or heard. But regardless, we'll keep on advocating for this. That's one thing that when I was working as a director at FNIB was the people that didn't take no for an answer were usually the ones that got listened to. So that's one thing that I kept in my head, is I'm not going to take no for an answer. We're just going to keep on advocating for this, because we know it needs to be done. We know how valuable it is, and it's not only us that are saying this. So that's why we're just going to keep at it. Next slide. Yeah, that one. So NIHB hires somebody to do a national review every 5 years in accordance with the Financial Administration Act. And this year they hired an independent contractor to conduct the evaluation of the NHB program. And AFN Health sits on the evaluation working group to ensure all parties are represented. We wanted to make sure that the NHB navigators were interviewed, as well as some of the clients that they work with. We wanted to make sure that it had a disability lens in it. We wanted to make sure that that the First Nations leadership were listened to. So they did interviews across Canada, and they're just finishing up, or they just supposedly finishing up the case studies. They're doing a case study on BC model, on the Northwest Territory model, and the Inuit model, and they're doing a case study with people who are experiencing homelessness. So I'm excited to see what they've come up with after hearing all these voices, and how the NHB program is impacting them, or not even impacting them. When we're talking about homelessness, I'm going to be doing another presentation in Vancouver. AFN's hosting a national homelessness and mental health forum in Vancouver to talk about the impacts of health, mental health, and health on First Nations people living or experiencing homelessness. Next slide. So AFN, like, we know we can't do this alone. We know that we need our partners. We know that we work better together. So that's one thing that we always make sure that, you know, we're strategically aligning ourselves with people that have the same vision and have the same goal or mandate as us. Like I noted, back in last October, we had an NHB National Dialogue session here in Saskatoon, and we had over 50 participants from all the 12 regions. And it served as a platform for knowledge sharing, collaboration, and progress in advancing the NHB advocacy. Key points from the National Dialogue session included, like I noted, the pharmacy talked about the client safety program. And then the national associations were invited, such as the Canadian Dental Association and the Indigenous Pharmacy Professionals of Canada. And they revealed inconsistencies in processes and messaging within the NHB program. We drafted a NHB resolution on allied health services, and it was stressed as being important to reducing mental health and addiction issues. The next steps included a summary report, which I could share, follow-up meetings with our partners, and the drafting of a resolution, allied health services. So this is an opportunity to liaison with provinces and territories, and it's a welcome opportunity for AFN Health. Provinces and territories have jurisdiction over health and receive federal funding through the Canada Health Transfer Fund to medically necessary health services for all citizens. In 2023, a sizable increase in federal investment over the next 10 years was secured. First Nations are in fact included in the fiscal transfer calculations, as the transfer is population-based. And it was noted that we are a young, mobile, and growing population. Due to poor population health status shaped by manufactured deficits in the determinants of health, such as poverty, food insecurity, culturally unsafe healthcare, First Nations across provincial and territorial health services more frequently than our access to health services are less frequent than our Canadian counterparts. Health jurisdiction can place First Nations at a disadvantage, as our people rely on a patchwork federal and provincial services, and are frequently, these two systems don't align. And not only just the federal and provincial, but then we have the local band level, and then those definitely don't align often. This often leads to jurisdictional disputes, with First Nations often caught in the crossfire of a system fraught with long wait times, limited access to diagnostics and treatments of their ailments. Disputes over capital and infrastructure funding hinders progress in communities who want more than ever to be able to offer programs and services closer to home. And that's another thing we hear, is that they want programs and services close to home, especially in northern, remote, and isolated communities, where healthcare services is so bad. AFN acknowledges that healthcare systems is facing simultaneous pressures, such as the overburdened human resources across the healthcare continuum, including the lack of family doctors, long wait times for non-urgent surgeries, delayed access to diagnostics and treatment of cancers, temporary emergency room closures, mostly in rural communities. The pressures of the opioid dependency accelerated by mental health crisis, leading to avoidable and premature death. Unfortunately, the reality of First Nations is not only do we face these inadequacies of healthcare system, but in fact, these health inequities are consistently exacerbated, resulting in dire consequences for First Nations people. Some First Nations are delaying care or outright refusing care in the provincial healthcare system, and this is resulting in delayed diagnostics and needless deaths. So there's a demand for a healthcare system for First Nations that is culturally safe. The opioid epidemic is hitting families and communities particularly hard. Addressing addictions and mental wellness must be done together, and it requires urgency in finding interventions that are evidence-based and impactful. One thing that when I sit in the meetings, a lot of the times when I'm advocating for something, they always bring up, well, we need evidence. Well, we need evidence for that. So that's one thing that I would like to share, or if you can share any information or journal articles, peer-reviewed journal articles regarding the impact of allied health services to health and well-being. I noted to them before too, and they hear me often when I say that, is that First Nations health is being determined by policies, evidence-based policies that are not First Indigenous research or not Indigenous-led research policies. So evidence. So I always tell them, like, it makes no sense. They need to be more inclusive, either have rely on qualitative research, Indigenous research methods as well, to identify this gap, because their evidence-based research is not cutting it anymore. Second last slide. Okay, and so moving forward, NIHB advocacy and partnerships roadmap. It's not really a roadmap. It used to be one, but I changed it last minute. Anyways, in closing, I would also like to thank the organizers again for inviting me to provide these remarks for this event. I'm truly honored to be here. This gathering offers a unique opportunity for us within Saskatchewan region to come share together, learn and reconcile. The looming healthcare gaps within our northern, remote and isolated communities may be reduced by continued advocacy and equitable resources. The inclusion of holistic healthcare in a comprehensive NIHB coverage will ensure affordable, accessible, and timely healthcare services, which will improve the overall health and well-being for First Nations people. And slide 15. So this is a graphic image done by our graphic recorder at the National Dialogue session in October. And each presentation came by, she talked about the different, what's stuck out for her. And it sums up the importance of AFN advocacy and building partnerships. And I think that's one thing, having this webinar with you today, I think that's one thing that I'm thankful, that I feel like we can do something together. So Nananskumtin, that means thank you in Cree. Any questions? Comments?
Hi,
Thank you.
I'm Court. Oh, sorry.
Yep.
No,
Can
I
I
was just
jump
going to open
in?
it up for questions. Yes, go.
I'm jumping in right away. My name is Cora Lee. I'm
Hi,
actually
Curly.
an occupational therapist, and thank you for doing your presentation and speaking to us here today. I just wanted to know if you had a list of allied health professionals that you were considering. Like, has there been sort of a list? I'm hoping occupational therapy's on there. So thank you.
Yeah, actually, yes, that was actually in my submission, my PBS submission, is occupational therapist for sure. Yeah. Podiatrist, massage therapist, chiropractor, physiotherapists. Yeah,
Lovely. Thank you very much.
yes, for sure.
Allison?
Thank you. Hi, Jenny. Thank you so much for this really awesome presentation. This was really informative. I'm the president of the Canadian Physiotherapy Association. So I'm a member of the Saskatchewan Physio Association, but I'm also the member or the president of the national organization. I've gotten lots of questions. I'll only maybe do one or two so others have a chance to
That's
jump in.
okay.
But
Yeah, that's good.
First of all, want to just offer our support. If there's any way from a national perspective, we can help assist you with any of your initiatives. There's significant data that we have on a national level regarding the efficacy of physical therapy. So I think we can be a really great partner and help support a lot of the initiatives that you discuss. So I'll put my email in the chat.
Awesome. Yeah, for sure.
Because I think hopefully we can be a good support in all those pieces that you're working towards. And I think it will be a great partnership if we can work together on some of these pieces.
Yeah.
So just put that as an offer of support. Curious your comments about the provincial health transfer.
Yeah.
Do you happen to know, were there stipulations or requirements set out specific to Indigenous health funding? I guess my worry is that often what we see is when that money goes to the province, it kind of goes into the big pot. And then we never necessarily see the outcomes that we hope to see at times because it just often maybe just goes into the hospital system or different pieces like that. Do you happen to know, were there any stipulations around how the funding was to be utilized around Indigenous health?
That's a really good question, and I could follow up with our director because she knows a lot more of the funding aspect of it, but I'll definitely follow up and then have an answer to you.
Yeah, no worries. It was really just kind of a curiosity, and it just always a bit of a worry in making sure the dollars are going to the most needed places.
Right. Yeah.
Thanks, Jenny. I'll let others jump in.
No one else has handed up yet. So Allison, I think you could go for another if you wanted.
This might be an easy one. Is there a next national dialogue plan?
That's a good question too. And I would really like for us to have another one because I thought it was so helpful. We got a lot of feedback on it because there was some people that didn't want to have like who was there? Okay, there was an Indigenous organization and then a Canadian organization. They're the same, but one was an Indigenous one, and they didn't want to really. The Indigenous one didn't really want to say anything because the Canadian one was there, and they didn't want to act like they were or seem like they were complaining, or something. So I was wondering like, how do we put those two in a room together so that they can hear each other? So yeah, that's something we're still kind of talking about, but yeah, definitely we want to have another one. We might be having a AFN health forum or session conference, but I will definitely let Adrian and Kendra know what the criteria or who the target market is for that.
Awesome, thanks.
Yeah.
Richard? Oh, you're muted, Richard.
Thank you. Richard Barras, I'm a partner in a private physical therapy clinic. Just with regards to naturopathic medicine not being insured by Saskatchewan Health and physical therapy being insured by Saskatchewan Health, are you emphasizing the non-Saskatchewan Health areas when you are lobbying for increased benefits? And is the assumption that, from your perspective, that the Saskatchewan health system is equitable and fairly distributed, sufficient enough to service First Nations in areas such as physical and occupational therapy?
I seriously don't think that they're equitable. I think there's a lot of discrepancy in the funding and reach of a lot of the benefits. So I think for us, we just want to make sure that we're heard, and that how it will roll out, I think, will come out if we get funding for any research and yeah, funding and research. Did that answer your question, Richard?
Yeah, and was there a lobby by the naturopathic physicians to draw your attention to their needs? And is that is there receptiveness to that, or is it? I'm just wondering why naturopathic medicine became a focus, and then all other allied health professionals became lumped together.
Yeah. So the naturopathic resolution was initiated by the executive committee. There was a leader, First Nations leader, that wanted to have that in motion. So that was set in motion by the executive committee. So because it falls under my my umbrella, I'm the one who has to advocate for it. So and then apparently I met with the naturopathic association, and they've been advocating for this for over 10 years. So, it kind of worked out that was in play already. So yeah, sometimes we can't really control what resolutions go forward. It could be based on what a First Nations leader thinks is relevant, and then the other chiefs agree. So that's how that one rolled out. And for the allied health services, that was brought up by the NHB navigators and at the national dialogue session. So that's how we drafted up that resolution.
Thank you.
Yep, for sure.
Melinda?
Hi, Jenny. Thanks for your presentation tonight.
Yeah.
I just had a question. If the NHB navigators are only accessible for NHB users, or if us as healthcare professionals can also reach out to them to help our clients navigate NHB.
Yeah, for sure. Okay, so the navigators are hired by the First Nations organizations. So their target their clients are the NHB clients. However, they do a lot of advocacy work and support service providers. So depending on where, like for Saskatchewan, the First Nations, the Federation of Indigenous Sovereign Nations, FSIN, they have a navigator that we also invite to our meetings. And then the Meadow Lake Tribal Council also has a navigator. So there's one for like kind of the north and one for the south.
Is there a way that we are able to find their contact information?
Yeah, for sure. I let them, yeah, I can actually share. Let's see, maybe I could share the information with Kendra or Adrian, and then I can give you that list. Do you want just the Saskatchewan region?
I don't know if anyone else on this call is from outside of Saskatchewan. I work in Saskatchewan, so it'd be helpful for me to have the Saskatchewan navigators for sure.
Yeah, for sure. Yep.
Any other questions from the group? Allison?
Promise this will probably be probably it'll be my last one. Jenny, do you have any advice for us? I think we all recognize, I probably can speak for most of the people on this call, the health inequities, and do probably feel strongly that in many situations physiotherapy can help with a lot of things. What would your advice be to us to how do we advocate and support our Indigenous patients and in our Indigenous communities? Any thoughts?
Yeah, that's a really good question. For me, I think how this all started was my physiotherapist is Amy, and she was listening to me yap about my work. And then that's how this came to be, you know. So just listening to your clients and seeing where they're at, and being able to advocate how, I guess, just continuing these meetings or these, I hope this is not just like a one-time thing. You can invite me to one of your meetings once in a while, see, Jenny, give me an update. You know, just making me accountable at the same time. And, you know, and then there's any new updates or something that, or any way that I feel like, you know, I could really use the spa to help me out here. You know, so anything that we can do together, align anything together. If you come and run into any issues, you know, you can reach me. I'm always available. I may not answer you right away, but I will read the email, and, you know, just working together, I think, and then keeping that door open. Like, just, I feel like this is just a step towards us working together and, you know, having that good relationship. And like what I was telling Kendra before earlier, is, I think, seeing what everybody does at each table, at each, you know, area, it helps. It'll help, I guess, see, okay, well, this person might be able to help me with this, or, you know, find those kind of linkages. I think that'd be really helpful, just to continue keeping that door open and listening to each other.
I think Brenna, your hand had popped up and down. Do you want to? And then I'll get to you next, Michelle.
Sure. I actually privately messaged Kendra because I'm having Zoom issues about raising my hand. But I don't, thank you so much for the presentation, Jenny. My name's Brenna Bath, and I'm the director of the School of Rehab Science and a professor there. So that's where we train physical therapists in the province, and have had a program there for a number of years, and are now in active development for new programs for occupational therapy and speech language pathology. So
Awesome.
tremendously excited to have those programs here, and certainly will go a long way in terms of we hope improving access across the board to people in Saskatchewan. I just wanted to highlight, and you may already be aware of some of the work, but there has been some tremendous history and work and relationship development and partnership with some of our faculty and staff at the school, with partnering with First Nations and other Métis and Indigenous communities to co-develop work and research related to community-based and directed access to care and a variety of things. And I heard you mention research and the need for evidence, and really not just about, you know, evidence that works somewhere else, but what does evidence look like from a First Nations, Indigenous perspective with in ways that are meaningful to Indigenous people. So I did want to just highlight that, and you may already know some of the folks I'm talking about at the school. I'm not sure, you know, in terms of relationships, and Saskatchewan in general tends to be fairly interconnected. But
Yeah.
working very closely with Stacey Lovo, Dr. Stacey Lovo, and Sarah Usman. Stacey in particular has been doing a lot of work in terms of virtual care, and is a director of rehab services and research at the newly developed Virtual Health Hub with Dr. Ivar Mendez. I'm thinking of what you mentioned a few times with the opioid crisis, and certainly I know my work with Stacey and others in partnership with Peter Ballantyne Cree Nation over almost a decade of relationship there has really brought that to bear about not having access to physiotherapy care or other pain management care services beyond just you know, the prescription piece. So there's evidence there that we can certainly share, working towards the peer review publication, but it certainly has had a lot of community engagement around new models of care, virtual care, and community-directed ways to evaluate that in ways that are meaningful. So a lot of narrative, a lot of story, and evaluating pain in different ways that are meaningful. And so I just wanted to put that offer out there that there's, you know, that willingness to work with you, your organization, work with the Saskatchewan Physiotherapy Association, Canadian Physiotherapy Association, occupational therapy associations, and others of how do we bring that work and that evidence from a variety of perspectives to help inform your work and really make it easier for you to build that case for rehab care. So thank you again for that. Yeah.
Thank you, Brianna.
Can I just say
Michelle?
before we go to Jenny, are you okay? How do you want there's so many connections here. I'm wondering, how do you want, are you okay if we share your email with individuals that request it? Okay.
Yeah,
okay,
for
sorry.
sure.
Yeah, we'll do that.
Okay.
All right.
You can
do
go,
you guys
Michelle.
hear me? Yep. Can you hear me? Okay. Thank you again, Jenny. This is lovely. My name is Michelle, and I am actually the president of the Saskatchewan Physiotherapy Association. And I am absolutely love the work that is being done by our Indigenous Wellness Working Group to continue to bring education to the forefront for our members and value and understanding of these very important topics. And I would just basically like to ask if it is all right with you if we have that list within the SPA for when we have requests coming to us of how do I access care, that it creates an easier translation of information. And with your permission, that we hold that within our association, because I think our group can attest to the requests that we get, and we'd like to break down those barriers as quickly as possible. So if that's all right with you, I would love to be able to support that.
Yeah, for sure. That's wonderful.
Excellent. And same thing. I look forward to whatever develops here in the future with CPA, the school, and ourselves, because I think it is an important time to create building these relationships and moving forward.
Awesome. Yeah, that's wonderful.
Thank you again, Jenny.
Yeah.
And I should say that Jenny was kind enough to say that we can share her PowerPoint. So when this is published, there will also be a PDF of the PowerPoint that shows some of what she discussed today as well.
Yeah.
Any other questions from the group here? Okay.
I think we're just all ready to help you get this ball across the goal line.
Yes, that's awesome.
I think that's the vibe I'm getting from this.
Yeah,
Excuse me,
yeah,
from
for
everybody.
sure.
So that's great.
Yeah.
All right, Kendra, should I close as if nobody else has any? Yeah, you're okay if I, okay.
Yeah.
So, okay. So we just want to thank you all again for taking the time out of your busy schedules to join us. And in closing, I just want to highlight a few things, much of what everybody spoke about here today, but what Jenny, spoke to, strength-based focus and approach through Indigenous lens, and that in the Q&A just seemed to really formulate and building relationships and working together. So yeah, I'll share all of the connective information, and when Jenny shares me the information, I'll make sure it goes through the proper channels. And thank you all. The recording is going to be available. Let's see if I do this. Kendra, jump in if I'm not doing this correctly. The recording is the recording is going to be available on the CSRS and SPA websites, and it should be posted within 1 to 2 weeks' time. And with that, thank you again, Jenny, and I look forward to what comes out of this webinar today.
Yes, awesome. Thank you again for everybody. And
Thanks,
didn't
everyone.
ASMR everybody to sleep. I tried to have a different, my voice wasn't too monotone.
Oh, it was great. Great.
Okay, awesome.